everyone, my name is Emily Vieser, and today I'm going to be talking about the presentation Stephanie and I created, which is mental illness and bipolar disorders. So, you might be asking, what is a mental illness? It's a condition that impacts a person's thinking, feeling, or mood and may affect his or her ability to relate to others and function on a daily basis. Every person, regardless of their diagnosis, is going to have different experiences, even if they have the same mental illness. So there's over 200 classified forms of mental illness, and some of the most common are clinical depression, bipolar disorder, schizophrenia, and anxiety disorders. So how does it affect our students? 50% of all lifetime cases of mental illnesses begin by age 14. Suicide is the third leading cause of death in youth ages 10 to 24, and 1 in 5 youth ages 13 to 18 have or will have a serious mental illness. So, as I mentioned earlier, one of the mental illnesses is bipolar disorder, which is a serious brain illness with unusual mood changes. It's also known as manic depressive illness. And so mania means feel very happy and or highly active, and depression is when you feel very sad or less active. So, symptoms of bipolar disorder. Some common symptoms of bipolar disorder show in a few different ways. Children and adults will often feel mood episodes lasting anywhere from a week or two, and these moods are very intense, and their energy and behavior are main changes felt within the person. So they might be very happy one day and very sad and depressed the next day. It's just saying that their moods change very often. So, how would you feel? What are some symptoms or thoughts that you may have in a manic episode? What are some in a depressive episode? So, here's just an illustration of a child. Says silly, serious, happy, angry, sad. These are throughout the day, as you can see at different times, how the child changes from its feeling happy and silly, angry, sad, kind of confused. So, this is just an illustration that was done by a child actually who was 13 years old, just as expressing her experience having bipolar disorder. So, as you can see, this is a lot for a child to be dealing with all these different emotions. So, bipolar disorder in children, early onset bipolar disorder is more severe. You suffer from symptoms more often, switch moods more frequently, and they can also exist with several problems. You can have substance abuse, ADHD, anxiety, and other mental illnesses along with bipolar disorder. And it's very important to watch for thoughts of suicide because, as I mentioned earlier, that's the third leading cause of death in youth, kids from 10 to 18. So treatment is done through either medication or therapy. Medication is used for the chemical imbalance, so to balance out those chemicals in the brain, and therapy is there for emotional support. Doctors also recommend going to therapy over medication due to the med's effect on the personality. So as we know, medication can typically have a lot of side effects, and especially in children. So this is another illustration done by a 13-year-old who thinks of her pills in a negative way. She doesn't feel like she's normal. So these are all things to consider as future educators. Living on the outside. For those who have to deal with someone who has bipolar disorder on a daily basis, being an emotional support and having patience when things go wrong is key. So this is, as teachers, as parents, you really want to support that person because if something goes wrong, it can really change and mess with their mood. And living with the disorder is a daily struggle, and learning the signs can make dealing with it easier. So kids don't always know about their disorder, so just being there to support them as they're kind of going through it. So acceptance and moving forward, you want to accept your loved one's limits. As parents and as teachers, empathize with the person and understand their feelings. Accept your own limits. You can't fix someone with bipolar disorder. You can only help them to achieve what you would like them to achieve. You can also help in reducing their stress because that can often lead to them worsening the symptoms. And communicate openly. You want to make sure routines are clear and you're open to changes so that the child can have fun. It's really important to be flexible in the classroom for these children. And here's just a couple of websites and phone numbers to go for help dealing with bipolar and suicide. So some classroom adaptations we can incorporate As it's really important to employ strategies that is going to promote the student's success within the classroom. So you want to address a variety of different learning styles, so the multiple intelligences such as visual, spatial, bodily, kinesthetic, auditory, just gearing your lessons towards multiple learning levels rather than just one fixated way of teaching. And you want to set behavior expectations for all the students within the classroom, because bipolar students might have those episode changes, so you want to make sure that the classroom expectations are laid out so they know what is expected. And you want to embrace diversity, including students with mental illness, so not only demographics but also mental illness, physical disabilities, all of the above. So some more classroom adaptations that you can actually do when you have your own classroom is assigning classmates as a volunteer assistant. Kids can really enjoy this. They feel like they're helping one of their classmates. Arranging frequent breaks for the child because they might need to take a break from getting overwhelmed. Providing private feedback on their academic performance. Also, having their test in a separate quiet room that can take off a lot of the pressure of exams. Having written assignments instead of oral presentations. Oral presentations can lead to a lot of anxiety for students, so that will take away from some of that. And extending time to complete some assignments because they might not always be able to focus the way a typical student would in a classroom. And then here's just a quote: "There's a tremendous amount of progress in understanding bipolar disorder. It's a bad illness to have, but a good time to have it." So here's just a few more illustrations. So hopefully this presentation gave you a little bit more of an idea on different mental illnesses, including bipolar disorder, which is what we touched on a little bit more of. But it's just really important to know that although these children are young, that's typically when they start developing these disorders. So to watch out for signs, communicate with the parents, communicate with the school, and just providing feedback and support any way that you can for the students. All right, thank you.